Hello, I'm Dr. David Saperstein, the Director of the Center for Complex Neurology, EDS, and POTS in Phoenix, Arizona. I'd like to talk to you about brain fog. It's such an odd term, but we found that it sort of works. So it's hard to describe, and the people who experience it, brain fog pretty much sums it up. It's just having fuzziness. Your brain's just not working like it should. And like fog, it can come in and then it can clear off. So it can be very intermittent. And a lot of things can cause brain fog, and certainly many of us can have brain fog if we're sick or exhausted or have certain situations going on. But there are certain conditions where people can be prone to brain fog. And particularly with autonomic disorders, mast cell disorders, a lot of the patients that we see at the center suffer from brain fog. And, it's very multifactorial, and there are so different things that can cause it, but in general, the biggest contributors to brain fog I see are dysautonomia. So if your body isn't regulating blood flow to your brain like it should, certainly your brain's not going to function optimally, particularly with standing up or exerting oneself. But, even when you're not standing, just having your brain not getting the right amount of blood at some times, even if it's getting better blood flow at others, that takes its toll and can cause brain fog. Not getting enough sleep will cause brain fog. So if somebody's in pain and not getting restful sleep, or if there's anything going on at night that keeps the body from being in the most deep and restorative phases of sleep, that's certainly not going to help. And then chemicals that get released into our system. What do I mean by that? So there's a disorder called mast cell activation syndrome, where certain histamine and other chemicals get released. We find that can be a big factor in brain fog. Those mast cells doing inappropriate activation or releasing of chemicals can be triggered by things. They can be triggered by foods that you eat. There's something called leaky gut, which can be a common theme in a lot of these diseases or others, where normal things that we eat that should just go out in our poop get absorbed into our bloodstream because, as I said, the gut is leaky. It's not as effective as it normally should be at keeping out certain components and absorbing just the nutrients. And so these other larger proteins that are parts of food that are innocuous in and of themselves, but they get into the bloodstream, and the bloodstream recognizes it as foreign, and there can be an immune response, and the immune system releases chemicals, and that could be. So any given person with brain fog can have it for different reasons, or there can be different reasons, and different ones could be the leading problem one day or the other. So identifying all of the things as best as we can that are going on, and then figuring out how to manage those problems the best that we can, are going to be the best long-term solutions to brain fog.